Delta Dental of Colorado Foundation partners with organizations across Colorado to ensure that all of our neighbors can access, understand, and value the importance of good oral health care. COVID affected dental offices really significantly to the fact that it essentially shut them down.
When it came to the outreach that we were doing with the partners, another thing that we came across was that the supports that our grantees needed looked completely different.
It impacted our funding plan significantly. One of the first things that we did as a foundation was give advance grant payments to all of our current partners that were providing direct dental and medical resources. We then launched an entirely new grant opportunity called the Community Relief Fund, looking at the data around patients primarily impacted by COVID and how that aligned to oral health.
We live in a very rural community, often a resource desert. So our role is really, really important in being an advocate for families, in connecting them to the many resources that they need for their family to thrive.
Our main focus is on emergency assistance, and we do that in a couple of different forms. We have our emergency shelter that houses 7 families at a time, and we provide rental, mortgage, utility, and water assistance to households that are experiencing housing instability.
Many of our small communities in Colorado and our rural communities really rely on small businesses, and the shutdown of those had a huge economic impact on communities and meant that many of our neighbors in rural Colorado lost their job.
When casinos close and restaurants close and bars close, it really, really hurt Teller County.
Typical client that we used to serve was low income or unemployed or living paycheck to paycheck. And since COVID's happened, though, we've seen that folks that were making a really good living wage or more than a living wage just didn't have adequate savings to be able to withstand a crisis this long.
There also were great racial disparities. About 40% of the patients in Colorado that positively contracted COVID were African American and ethnic minority, but Colorado is not 40% minority population.
A way to look at the pandemic today when it comes to the alignment that it has with racial social justice movement that's going on today is that we should be keeping 6 feet apart from each other to keep each other healthy. But right now, we're interlocking hands because that's how meaningful this whole movement is. That's how meaningful this pandemic is, because we really do realize that we're all in this together.
There's been a lot of systemic challenges throughout history that have led to, just inconsistencies and, disparities in poverty and housing and criminal justice, as well as education and healthcare. So we're really just trying to make sure that we're part of the solution, not a part of the problem.
These organizations either are those ones that can help support these communities. If not, they have that network.
Right behind me is the COVID testing that we're doing in our community 5 days a week. We're really, really fortunate to be co-located with our public health department.
Though many of these organizations pivoted their original day-to-day work, they've always kept the best interest of how to improve the community's health top of mind. And so what they're going to do is connect these families, these individuals, to a dental home, to a medical home.
You'd be surprised at the amount of folks that come to us just without health care. So one of the first things that we do when somebody steps foot in our shelter is, do you have health care? Do you have a primary care? Do you have a dentist? Do you have any of these services? Do you even have health insurance? And helping just connect them to that basic resource.
So we are grateful for this opportunity, sorrowfully that came out of a pandemic, but grateful for this opportunity to meet new partners in Colorado and build new relationships in a way that we otherwise would not have had the opportunity.
Community Partnership is incredibly grateful for the extra support that we've received during COVID. We've been able to keep every single staff member employed throughout this emergency at their full capacity. Our emergency funding has given us the flexibility to come up on the fly with virtual formats of things for families to answer their questions, to give them reassurance, and to connect them to resources that they need.